Welcome back. Well, little is currently known about how breast cancer and the coronavirus interact, as the virus is too new and data is only slowly becoming available. However, much can be deducted from the readily available knowledge about the coronavirus infection pathways and the general influence that cancer therapy has on infectious diseases. Well, cancer, just like other health issues, does not stop simply because the coronavirus has appeared on the scene. It would be tragic if the fear of the virus led to the delayed diagnosis and treatment of cancer with inevitable unnecessary loss of life. I speak to specialist surgeon with an interest in breast and soft tissue oncology. That's Dr. Justus Apffelstaedt about this. Doc, good morning to you and thank you for your time.
Good morning, listeners. Good morning, Lindy. Thanks for having me on the show.
Well, what do we know about how breast cancer and COVID-19 interact? I mean, I said in my intro that, there wouldn't be much information given that COVID-19 is relatively new.
Yes, that is indeed so, but we can deduct from past experience. And we also see, and this is for me the most tragic interaction, that is the socioeconomic interaction, because people are afraid now to come for their screening examinations, and it's estimated that in the United Kingdom, during the hard lockdown, every week about 2,700 new cases of cancer were not diagnosed. Now, the impact of that, particularly in breast cancer, is if you delay the diagnosis by more than 1 month, your prognosis deteriorates rapidly. If we delay the diagnosis by something like 3 to 6 months, we have a loss of more than 20% in the long-term survival. The tragic part of this is that women will not drop dead, but we will see this increased mortality in 5 to 10 years' time. We estimate that the lockdown has put breast cancer treatment and therapy and outcomes back by 10 years' time. And this is very tragic because breast cancer, if it's being picked up early, is a curable disease, and we are moving backwards now. Sure. If we're looking at the treatment of breast cancer, we think that surgery as such is safe. If we're looking at radiation therapy, also that seems safe. Hormonal therapy is safe. The big problem is chemotherapy, which actually decreases the human body's resistance to infections, and we expect problems there. But we can space treatments and we can delay treatments in order to get out of hotspots. Last but not least, I would wish to add that COVID-19 has a mortality of about 0.1% for the general population. Breast cancer, which attacks younger women, usually from age 30 onwards, has got a much higher mortality.
Sure. I mean, as a doctor who works in the field, what are your predictions for the South African context? I mean, you've spoken about the virus having affected the diagnosis and treatment of cancer. Just last month, we saw reports that there's a fear of contracting COVID-19 has led to a decrease in new cancer patients that were referred to the Groote Schuur Hospital and a decrease in those who are going for chemotherapy. So what would you say that the picture looks like in a South African context?
Number one, we're already seeing that we are seeing more advanced cancers because the time from the first lockdown, which happened in March to now, has seen to it that the screening for cancer has almost come to a standstill. And this is very tragic because here the biggest gains in survival are being made. So we are seeing already now that we're seeing a lot more advanced cancers that also then need more intensive therapy. We could show in my unit that when we detect a breast cancer at screening, you will save half of the chemotherapy in the first place. You will save about 2/3 of the highly expensive biological treatment. So for me, as a cancer doctor, the appearance of COVID-19 has been an unmitigated disaster for women with breast cancer. And for understandable reasons, because people are reluctant now to go to hospitals, but also for the impact it has because it will leave many women much poorer and less able to afford screening visits. Here, for me, lies the biggest problem.
And so let's speak about that issue of affordability, right? When it comes to screening, when it comes to the treatment as well that you would have to go through. I mean, everything from surgery, radiotherapy, systemic treatments as well, I think that you've mentioned. How do we make sure that when we come out of this pandemic, or while we're still dealing with it, that these treatments are affordable?
These treatments are, the epidemic doesn't change the price of the treatment. And one should see that one, and this holds true for all other health interventions that we routinely follow, like, for example, going for your cardiac examinations and treatments, giving you hypertensive medication, and so further and so forth. Women should go for their regular mammographic screenings, if they can afford this, and follow the regular treatment routine that they have for their breast cancer. Most of the oncologists in the field are fully aware of the problems around chemotherapy and COVID-19. We have, for example, in our practice, we've put strict COVID-19 precautions in place, and we can tell the women that their fears of going to a hospital can be ameliorated if they go for the screenings to an out-of-hospital type of environment. For example, a unit that does exclusively breast health, like, for example, our units and similar units around the country, and they're out of a hospital environment, so you're not sitting in the same waiting rooms like people with lung problems, which may spread the disease. It can be done. And remember one thing, you are much more likely to die of breast cancer than of COVID-19.
You know, Doc, as you're speaking and you're saying that, COVID-19 doesn't change the price of these treatments, I think it's rather sad, because we've seen studies that have come out to say of those people who have lost their jobs in South Africa, the majority has been women. These are women who now, don't have the money that they had while they were still working, are now possibly out of a job, who may suspect that they might have something wrong with their breast but can't afford to even go test. And those who have tested can now not afford that treatment.
I think this is to a large degree not 100% true. Because if we're looking at the big units in the public sector, like, for example, here in the Western Cape, the unit at Tygerberg, the unit at the Grooteskier, they're still functioning. And they're still treating indigent patients. So, in general, I find that in this country, except for the healthcare hotspots that have been well published, where the public health system has collapsed, but that is not something that is new. If you're looking at certain provinces, it was problematic already before COVID-19 and has not changed much. It was poor in those provinces. Here in the Western Cape, in Gauteng, in KwaZulu-Natal, there are big public sector units that are run by my colleagues, and I can vouch for that there women will still get the appropriate treatment within the resources of the public system, and the quality is actually quite good. We have shown this on numerous occasions and numerous studies that our outcomes are actually similar to those of overseas units and comparable to the private sector. So I think we mustn't go too much into panic mode. We must fight for the right of each and every woman in each and every province to have proper health care, and not only Western Cape, Gauteng, and areas of KwaZulu-Natal.
Absolutely. Doc, as we close, your advice to women who either suspect, they might have breast cancer, or those who have tested and should be going for treatment, but are just too afraid to go to these health facilities as we fight COVID-19. Your advice to them?
You should, if you're in the public sector, you have relatively little choice, but there are big specialized breast clinics available at here in the Western Cape, Grooteskier, Tygerberg. I know that there are similar units in Johannesburg, several units at Baragwanath and at Helen Joseph Hospital. In Durban, Peter Maritzburg, similarly. in the private sector, you can look up specific units that are outside of hospital, and that will alleviate your fears. But do not neglect that. Once again, breast cancer is much more lethal than COVID-19.
All right. Well, thank you so much for that. We'll leave it there. That's Dr. Justus Apffelstaedt, who is a doctor, specialist surgeon with an interest in breast and soft tissue oncology.